right, we're back. And in this segment, we're going to talk about abortion. All right. So there are different ways that abortions can be conducted. One is what's called a surgical abortion. And this is where you either get a vacuum aspiration or you get a dilation and evacuation. Usually the vacuum aspiration is reserved for earlier in the pregnancy when the contents of the uterus are going to be a lot smaller and could potentially pass through a cervix that isn't that dilated. If it's a little farther along, then the cervix is going to need to be mechanically dilated and the contents evacuated. So in both of these cases, though, the evacuation is going to be conducted generally with some kind of vacuum type of strategy. A lot of times following a surgical abortion, a curettage will be needed where the place where the placenta had been implanted needs to be sort of, the only word I can think of is burned, basically, with an electrical current to make sure that there's not excessive bleeding and things like that. Medical abortions have become a lot more common since RU 486 was initially approved back in 2001. The official name that we tend to use in the US for the brand that's sold here is Mifeprex. In Europe, it's referred to as RU 486. These are prescription pills that will induce a miscarriage, is basically how they work. So if you recall, when a conception occurs, or even in the days prior to, implantation, so we may just be in our regular menstrual cycle, and in the premenstrual days, a whole bunch of progesterone is secreted in case of an implantation. So in preparation, the body starts to secrete progesterone, and that's going to help maintain a pregnancy. So in Mifeprex, the premise is that we're going to provide a progesterone blocker so that any progesterone that's being secreted is not going to have the effect that it should have on, building up the uterine lining and maintaining the pregnancy and so on. So that's the primary way that Mifeprex works. So first off, you would have to go to a doctor for this. It's a prescription only. And this is not the morning after pill. This is Mifeprex, which is after a known pregnancy. And so you would be prescribed 600 milligrams of mifepristone, and its major function is to block progesterone. And then it's also going to have the effect of softening and dilating the cervix and encouraging the endometrial layer to thin out and to shed. 2 days later, a 400 milligram dose of misoprostol will be taken, and that causes the uterus to contract so that the contents of the uterus will be ejected more readily. So basically, it's causing a miscarriage. One of the primary causes of miscarriage that I mentioned was having a hormone imbalance. Well, in this case, we're making the hormone imbalance so that the pregnancy basically fails. After the completion of the medication, 2 weeks later, it's important to follow up by seeing a doctor to make sure that the procedure was effective and that the person is in fact no longer pregnant, and to make sure that everything was expelled, because you can end up with infection if not. So it's really important to follow up with that 2-week doctor visit. The FDA has approved Mifeprex for use in pregnancies for up to 49 days. So that's basically 7 weeks after conception. And it's 97% effective in that time bracket. Some doctors have been administering it even farther along in pregnancy with a little less effectiveness. But the reason why they would go Mifeprex instead of surgical abortion is because it's a little less invasive, and, there's less pain involved and less recovery involved if you can go with the medical route. So some doctors have been off-label using Mifeprex past the 49-day use and have had some success with that. I'm often asked in class, what happens if the pregnancy isn't terminated with the Mifeprex? So either you can follow up with a surgical abortion and end the pregnancy that way. Some cases, the mom has said, maybe this was meant to be, and I'm going to go ahead and continue with the pregnancy after all. There are no known side effects from an embryo being exposed to mifepristone or to misoprostol. They don't all they do is interfere with progesterone and then, can cause uterine contractions. And so if the implantation survived those two things, then, nothing should come from that would be harmful to the developing embryo. So some moms have changed their minds after attempting an abortion with mifeprex. Others just follow up with a surgical abortion. So there are some stereotypes that I think people carry about abortions. And so I wanted to show you some statistics pertaining to different aspects of abortion. I think a lot of people think that, later abortions are really common. But if you look at this graph, and this is from 2010, I haven't been able to find a more recent one that is, as well done. But the darkest color orange is abortions that occur at 7 weeks or less. The next segment there that says 29.8%, that would be abortions that are conducted between 7 and 8 weeks after conception. And then the next one over, which says 25.7%, that's abortions that occurred in the 9th through the 12th week. So if we add those up, we see that the vast majority of abortions occur within the first 12 weeks after conception. Then we have 6.2% that are occurring in the 13th to the 15th week. And then we see 3.6% that occur in the 16th to the 20th week, and 1.2% that occur after 21 weeks. So we're talking about abortions that are very rare in pregnancies that are more than 21 weeks of gestation. Remember, gestation's 40 weeks long. So the vast majority happen in the first half of pregnancy, and among that, the first trimester is the most common time for abortions. I'm recording this in February of 2022, and Arizona just made news by passing a law that restricts abortion after the 15th week. For the vast majority of women, as depicted by this graph, that would, like 94% of women would be included in that time limit. The vast majority of women have their abortions early. The remaining I guess that's maybe 5% of women who have an abortion after the 16th week. A lot of times that is related to, the result of an amniocentesis that shows, significant abnormalities that are inconsistent with life. Abnormalities that put mom's life at risk, that if she were to carry the baby to term, she may lose her reproductive capabilities or she could die. It's very rare for women to just choose to have an abortion after 21 weeks. And in fact, in the Roe v. Wade decision that legalized abortion in the United States, the law states up to the point of viability, which today in the U.S. is about 24 weeks. So it's very, very uncommon for women to have abortions after the point of viability. Another stereotype I think a lot of people hold is that abortions are something that teenagers do, or that only really young women do, women who are unmarried and don't know what to do. But yeah, that accounts for about 50% of abortions. 24 years or younger accounts for about half of the abortions. The other half are in women who are older. And if you remember that chromosomal abnormalities might be a reason for an abortion, it makes a lot of sense to see the 35 and over abortion rate, where women oftentimes are making that decision because they realize that their baby is significantly impaired because of chromosomes. But there are women who are married and have children and decide to have abortions because they don't want any more children, and or other factors in their life that have made it, they statistically don't fit the stereotype of, teenage unwed mom kind of thing, but other factors contribute to their decision to have an abortion. So I just wanted to show you this graphic to maybe illustrate that about half the time you might be right to think that it's an unwed mom younger, but the other half of the time you'd probably be wrong. This is per 1,000 women aged 15 to 44, abortion rates by race. And what you see in the right-hand side is the percentage of women who are having unintended pregnancies. So in the dark blue bar, that would be white women between the ages of 15 and 44. And for every 1,000 women in that category, 35 will have an unintended pregnancy. Whereas for Hispanic women, 78 will have an unintended pregnancy. And among Black women, it'll be 98. If you look over at the abortion rate, it's kind of proportional, right? So the abortion rate among white women is about 11 per 1,000 between the ages of 15 and 44, about 28 per 1,000 for Hispanic women, and about 50 per 1,000 for Black women. And it's kind of proportional to their unintended pregnancy rates. So it's for Black women, about half will choose abortion when there's an unintended pregnancy. For Hispanic women, about a third, and for white women, about a third will choose abortion if there's an unplanned pregnancy. Again, this is from 2011. This is the U.S. abortion rate, and it's actually continuing to go down since 2011, so that's good news. But what we're seeing is that we had a peak of abortions, between 1979 and like 1991, and then it's been really declining in the years since. And part of that is because more women are choosing to keep their babies. Part of it is because we have a reduction in unintended pregnancies since 1991. More people are using condoms at every sexual encounter. There are more long-term contraceptive methods that we've talked about. And so there are a lot of factors that are going into the reduced pregnancy rate, unintended pregnancy rate, that are also then having an impact on the abortion rate. So abortions have been going down, almost back to where they were when Roe v. Wade was first passed. All right. How about some things that happened to mom? Well, let's continue on with that. Here we have about 9th week after conception. A lot of times moms are kind of surprised that, while they might be having a little bit of a protruding tummy or thickening of their waist, that they don't really look pregnant. Maybe their clothes are starting not to fit very well if they have tight waistbands or something like that. But most women are a little surprised that, I'm 9 weeks pregnant and you can't even tell, right? By 24 weeks, there are fewer women who are saying that. The fetus is getting large enough to really be occupying more of the pelvis. And so it starts to push the organs upwards, starts to push itself outwards. I also want you to notice in this picture the changes in mom's breast shape and size. That's going to be a surprise to a lot of first-time moms in particular, how much their breasts change during pregnancy. A lot of times so much is happening to so many parts of their body. Also look at the for lack of a better word, butt on the right-hand side compared to the left-hand side. Women, when they gain weight during pregnancy, tend to gain weight throughout their bodies. It's not just on their abdomen. And so a lot of times with all the changes going on in the body, women are surprised that their breasts have changed as much as they really have. By the 40th week after conception, you're seeing a full-term mom here. She's ready to have this baby anytime. And you see a lot of, obviously her abdomen is very clearly showing that she's pregnant. And then you can really see that her breasts have changed in shape and size and consistency, really. A lot of times when moms give birth, they're like, why would I try and nurse this baby? There's nothing in my breasts. But their breasts have actually started to produce colostrum even prior to the delivery of their babies. So there's a lot of things that are happening during this this period from conception to birth. Now, something I wanted to mention about the 24th week that I forgot to say was that a lot of times during the second trimester, moms will start to feel what we call quickening, which is the sensation of their babies kicking inside of them. Usually it's such a faint kick or flutter that the mom can feel it, but nobody else can. And she might not even be sure that that's what she felt. She might think that she's just having like a muscle twitch or something very specifically in her pelvis. But as the baby gets larger, it'll start to make bigger and bigger movements, and it'll be much more obvious. Between the average time for women to detect quickening is about the 15th week after conception. Usually by the 20th week, she's really certain that that's what she's feeling. And in fact, within another couple weeks, the kicks can be felt from the outside as well. I thought it would be fun for you to see, not only can you feel it from the outside, but you can actually see it from the outside also. So I'll stop here and I'll let you watch this video, and I'll see you on the other side.